men's health drugs. Primarily, they're used as replacement therapy. For whatever reason, the male doesn't have sufficient amount of the hormones, so we're giving him more. But there are other uses for these drugs rather than just replacement therapy. Testosterone is a primary androgen. It's responsible for male characteristics, the development of bone and muscle tissue. It slows or blocks the breakdown of protein within the body, and it also is responsible for the retention of various electrolytes. There are synthetic derivatives of testosterone, and these drugs can be given orally, but they can also be given sublingually, buccally, and there are transdermal patches and gels. Let's take a few minutes to talk about anabolic steroids. These are used for muscle building, and there's a great potential for misuse of these drugs by athletes. Sometimes you'll hear of cycling with these drugs, which means they use them for weeks or months and then they take a short break, and then they go back on it for weeks or months and take a short break. And sometimes you hear them refer to it as stacking, which means taking more than one anabolic steroid at a time. Adverse effects with anabolic steroids: severe acne and cysts of the skin, gynecomastia, testicle shrink and infertility in men. For women, there's voice deepening and growth of body hair. There's an increased incidence of cardiovascular disease and heart attack. There are some severe liver implications. And we have aggressive behavior and violence. Drugs to treat erectile dysfunction. Well, Viagra was the first one on the market, and it works by relaxing the smooth muscles and increasing blood flow to the penis. It is contraindicated in those taking nitrates because it's associated with severe hypotension in that case. And there are other drugs within this classification as well. For all the drugs that are used to treat erectile dysfunction, we have adverse effects. The common ones are headache, flushing, gastric distress, chest pain, hypo or hypertension, priapism, which means an erection lasting longer than 4 hours, and unexplained visual loss. Androgens cause fluid retention. So regardless of why the person is using androgens, we can see some edema, and that's got some pretty serious implications. If the person has cardiovascular disease, we'll see worsening of the disease.